Vascular dementia is the second most common type of dementia, and is the type of dementia that is typically caused by vascular disease, stroke and mini-stroke in the population. But despite that knowledge, our understanding of how to prevent it is very limited. So in this study we wanted to look at the relationship between elevated blood pressure and risk of vascular disease, in particular by age of the patients. Overall, there was a positive association between elevated blood pressure and risk of vascular dementia, but that overall effect differed significantly by patients' age group. We observed the strongest association in the younger patient population, where for each 20 mm mercury difference in systolic blood pressure, the risk was roughly increased by about a third. But looking at the oldest patient group, those aged 70 plus, what we found that in this patient population there was no strong association. I mean, one of the key findings from the study was to show that elevated blood pressure increases the risk of dementia, and that could suggest that if that association is genuinely causal, reducing blood pressure could prevent a substantial proportion of people suffering from vascular dementia. The second implication was the study provides reassurance to patients as well as physicians that even at old age, reducing blood pressure is unlikely to cause any vascular dementia. And the third implication is what we found, that the association between blood pressure and vascular dementia was only partly, about only a third of that association was mediated through previous stroke and TIA, suggesting that treating blood pressure is likely to have a much larger effects and focusing on people who have not had a stroke or a mini-stroke is likely to lead to reductions risk of vascular dementia.